Infertility is not only a physical problem but a huge psychological burden, as many of you may be experiencing this. I don't think it just affects only the couple or the person who is planning to fall pregnant. Unfortunately, in the eyes of the society, they get labeled or called in many different ways, which adds to the burden. We all come from different cultural backgrounds, so we all have different views on infertility. For some, it's not an issue. It doesn't matter if you have a child or not. For some, that is a life and death question, because unfortunately, that is what their experience has been within their own cultural setting or the community they come from. So the important thing is empathize. So whenever you see a couple or a young woman, I don't think it's appropriate to ask as the first question to say, have you got a child? Let them open up to the conversation. There's so many other topics you can always discuss about, isn't it? Are you happy? How's the weather? Where have you been traveling? Lots of questions. Is this your favorite food? Have you watched this movie? Do you enjoy watching movies? Or what sport do you play? And I think that's the conversation we should have with females or with girls. And let's start bringing on the change so the next generation doesn't carry the trauma of what this generation has been going through. So that's really important. But otherwise, in general, if the couple is struggling to fall pregnant, I think a little bit of empathy goes a long way. How can you help them? Probably not talking about it, or seek their advice how they would like to approach. Let them open up and see what sort of help they need, and then you can take it from there. It's not an easy journey for anybody, especially in closed communities or some ethnic and cultural communities. There's a lot of taboo associated with it. I've had many young women, especially women from my own community or Asian or Middle Eastern community, who are very young and within less than 12 months of marriage or less than 12 months of the relationship, they are expected to fall pregnant. That's a huge pressure. They could be second generation migrants, but still that pressure is on them. So it is really difficult for them to come out of that circle to achieve something or do something with their own life. So that's why it's important for us as women to have this conversation with our daughters. Also help sons undergo this journey in a more pleasant manner rather than struggle with it. Normalize the topic rather than attach a taboo to it. That's one way of approaching the subject. I'm sure you all would have had your own ways. But if you are a couple who is struggling from these kind of things, please go and see a psychologist so you can prepare yourself for what's to come. Lead or enter the pregnancy in a positive note. So if you're someone who is psychologically affected because of this, then you're more than welcome to come and see me at athenawomensclinic.com.au. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. All the best with your journey and enjoy the pregnancy and what comes after as well. So all the best.